of course, the tibia, which makes the kind of the basement of that knee joint from your shin bone. And then on the front is your kneecap or the patella. These surfaces of the bones are lined with an articular cartilage, which is a soft tissue, thick, kind of smooth tissue that protects and cushions the joint. And as you can see in that little video that plays on the side there, that impact on that articular cartilage over time can unfortunately cause some damage and wear and tear. And that's when we get into the arthritic knee. So, though arthritis, osteoarthritis specifically, is one of the most common diseases that affects the joints, and the knee being the most common one. This breakdown or wear and tear in the joint then causes a reduced joint space. So the space between the top of the knee and the bottom of the knee gets smaller, and that cartilage gradually wears away. So we get into fraying of the cartilage, and we get like a rough surface along that joint space. And then we start getting bone rubbing, bone on bone, which of course creates a inflammatory process and a protective response of the body. That's when you start to feel symptoms, or at least some more severe symptoms in the knee. So the symptoms that could arise, that if you have knee OA, you probably are feeling. We're going to have swelling and stiffness. So again, that's your body's way of trying to repair what's going on inside the knee. So our knee gets nice, hot, swollen, and doesn't like to move. Of course, coming with this is pain. That pain can feel like a very strong ache in the knee. It can be sharp with movement. Often it comes with, I was doing a lot of activity and now my knee really hurts. So you can see on the side there with the stairs, you get reduced function with that. And then tender to touch. So to touch, especially most common on the inside of the knee, starts to get really sore to touch. And then once you get into the bone on bone, you start getting grinding, snapping. A lot of people say it sounds like snap, crackle, pop Rice Krispies in there when I'm walking. All of these are signs or symptoms, I guess is a better term, for knee OA. At this point, often your doctor will send you for an x ray to give you a confirmed diagnosis of knee OA. And they're looking both at your history and then, of course, the picture of the knee to give you that diagnosis. So then how can physio help with this? There's lots of research out there stating that low impact activity can actually help improve your quality of life with a diagnosis of knee OA. A lot of people are nervous to exercise because when I do activity, it hurts. So it's getting specific exercises, low impact strengthening exercises to the muscles that support the knee and the hip, and that's what's going to help you in the long run be able to do those more functional activities such as stairs. Mobility, so that's your with your physiotherapist, mobilizing the joint, mobilizing the tissue, getting smoother movement and healthier tissue to decrease pain, swelling, etc. And I can think the biggest thing that ProTX offers outside of our hands and exercise is laser therapy. It's an incredible technology that provides the energy to the damaged cells of our tissue to return its tissue to normal function. And what I mean by that is obviously when we have injured tissue, the body needs energy to in the cells to repair that tissue, and that specifically is in the mitochondria. So the mitochondria of the cell produces about 90% of the energy that is necessary, and when our tissue is injured, it can't produce this energy. So that's where the laser comes into play. So as you can see in the picture, we put this light on you that pummels the cell with the energy that's required to increase the metabolism and speed up the cell's tissue repair. Along with this, you have improvement in the inflammation. You can restore, decrease in pain because it affects your pain receptors. ProTX clinics use the BioFlex laser, which is one of the more advanced systems because it uses both red light, infrared light, and then a powerful class 3B true laser that then can go even deeper into the cells. So these three things in combination has shown to really affect and improve your quality of life, decreasing pain, increasing function. So with that in mind, ProTX created a knee OA program or a knee osteoarthritis program to help our patients that are diagnosed and waiting and waiting and waiting either to see a specialist or maybe they have seen someone and they've been told it's a 2 to 3 year wait for anything to happen or that they're too young for surgery. There are things that can be done to help you with your pain. Keeping in mind, no, we're not going to get rid of your arthritis, but we are going to help you manage it and help you potentially slow down the rate, but at least help you manage and improve your quality of life. The OA program begins with a very detailed assessment with the physiotherapist. This includes range of motion testing of the knee and the hip. We look at strengthening your strength measures of the knee and the hip. The clinics use a very handy device that will actually give you a reading of how strong you are. So, for example, you can kick your knee out at 10 pounds versus 20 pounds on the other side. So you get a very clear picture of how strong or how weak those muscles in your legs are. From range of motion and strength, we move into more functional assessments. So that can involve stair use, it can involve squats. We look at various things to kind of help us get a clear picture of where you are at, and then you begin the multi-phase protocol. So that involves a component with the physio, it involves an exercise component tailored to where you are at functioning, and then of course it includes the laser to help with more of the improvement in the quality of the tissue. All of this together is from the physio side of things, sorry, is going to improve your quality of life. And every couple weeks, we do a reassessment to confirm that things are progressing well, and we either we move you around accordingly, or move you around in the protocol, I should say, according to where your measurements are. So everything's tailored to you. It is a set protocol, but we monitor and make sure that there's progress and provide you the necessary tools to do so. Involved with the NEOA program outside of physio is bracing, and that's where I'll turn it over to Mazin, who is our bracing specialist.
Thank you so much, Jen, and thank you for these incredible polls. They're obviously very insightful. Thank you, everyone, for joining us. Let me take a second to introduce myself. My name is Mazin Brisha, or you can call me Maz as well, Maz the Brace Guy. And I'm the bracing and product specialist at ProTX Services in all 4 of our locations. And I'm here to talk to you about NEOA bracing. So obviously, Jen has gone quite in depth in terms of what NEOA actually is and how it comes about. And I'm here to explain to you why bracing is an excellent supplementary choice for you to help you along your journey towards better overall knee health. Obviously, bracing can help with knees, whether it's acute knee pain or chronic knee pain, but it's very specialized when it comes to knee OA, and there are very particular types of braces that I'm going to go into quite a bit of depth in today. So please, if you have any questions, let me know throughout my presentation, and I look forward to hearing from you at the end. All right, so why bracing? Well, let's talk about the benefits a little bit first. So obviously you get a lot of increased stability and improved mobility. And with knee OA, a lot of what you notice a lot of times is that there's always a risk of your knee giving way. And having a hinge brace around your knee is something that dramatically decreases the chances of your knee giving way and increases the mobility and stability of the knee. And that's obviously very important for your overall function of your knee and being able to maintain physical activity at whatever level that you're currently at, or if you want to achieve a higher level. Um, and something that I did want to really stress on today was supporting healthy knee alignment. A lot of people really overlook the importance of healthy knee alignment. And as Jen discussed today, that a lot of the cause of knee OA is because of that knee alignment. When the knee alignment is skewed, it can affect your gait and it can affect the way you walk. And whenever someone suffers from knee OA, especially in one compartment, they tend to compensate by limping in a certain way or walking in a certain way. And what we see with that overcompensation is that there tends to be detrimental effects to the rest of your body in terms of your hip, in terms of your ankle, or your opposite leg as well. So improving and supporting your healthy knee alignment is incredibly important for the overall health of your knee. And that's one of the main functions of hinge braces and the two bracing types that I'll be discussing later on. And obviously, knee OAs can be very painful, can be very uncomfortable, and mitigating that pain and reducing swelling is a key part of why bracing is such a good solution for so many clients and so many patients, because it's almost an immediate, instantaneous relief the moment that when you step on when you're weight bearing again and the hinges carry your weight or it absorbs your weight. It's a significant difference that you'd feel straight away and would help you continue with your physiotherapy treatments and help you achieve your physical activity goals. So if you move on to the next slide there, I can talk to you more about your bracing options. So obviously I do fully appreciate that the bracing world is very vast, and for many people, it can be a bit of a psychological barrier to step into the bracing world, as most people have never worn a brace in their lifetime until you have to, or until you consider the actual positives and pros to it. So there are two primary brace options that we consider here at ProteX as being the best brace options for knee OA. And those are the spring-loaded technology and the unloader and offloader technology. So I'll go through the differences between them a little bit more. So unloader technology is only unicompartmental or primarily unicompartmental, focused on the tibiofemoral compartments of the knee. So that's the medial and lateral compartments on either side of the knee. So the inside of your knee and the outside of your knee. And I have an example here of what an unloader technology brace would look like. So we'd have two hinges on either side where the unloading and offloading occurs. So at the effective compartment, the hinge would push on the other side to open up the affected compartment to relieve that pressure there and make sure to mitigate any grinding that occurs and to increase the space within the cartilage that's obviously wearing out. So that's how an unloader technology brace looks like. And with unloader technology, we're able to offer you a 3-week trial. All you need to do is come in for a bracing consultation, and you'd be able to walk out the doors with a comparable, not custom, but a comparable size fit for you that would show you the impact of an unloader and an offloader brace. And our second option here is a spring-loaded technology, which is definitely a little bit more advanced. And the first thing I do want to stress is that the spring-loaded technology also carries an unloading function. So both braces do have an unloading and offloading function. Where they differ is mainly towards the severity and the compartmental nature of your injury. So with bicompartmental and tricompartmental, the spring-loaded technology is the gold standard, without a doubt. And for overall knee health, the spring-loaded technology can be considered the gold standard because it it reduces the pressure in the overall knee rather than just one compartment. And that's why this is excellent for anyone with compartmental OA. It also assists with knee extension. So what a spring-loaded technology brace usually has, it basically has an embedded spring within it that assists in extension, and it minimizes the pressure in flexion as well, which is something that the unloader technology brace does not perform. Both of these braces come custom. So when you come in for a bracing consultation, we'll be able to get your measurements. We'll be able to order you one, and be in within a couple of weeks most. And yeah, so of course the differences between them. The reason why the spring-loaded technology is the gold standard is because it encompasses a higher level of injury, and it's able to withstand higher severity of injury as well. And for people that struggle with a sit to stand, for example, that's when the spring-loaded technology can really be felt instantaneously. And of course, with that, it has to be mentioned that the spring-loaded technology is also cheap. It's also more expensive than the unloaded braces. But if you move ahead to the next slide, I can go into more details about how bracing actually works and how the bracing technologies actually work. So as I went into quite a little bit of detail about the unloader brace, which the unloader function exists in both these kinds of braces. The way it works is that on the side of the hinge, so the most common compartment that is usually damaged is the medial compartment, which means the inside of your knee. So if we have a client that the medial compartment is injured or is damaged, or knee OA exists there, the brace would need to press onto the unaffected compartment, which is a lateral compartment, to open up the medial compartment, as you can see in the diagram here, to offload the area. What that means is in the weight bearing process, whenever you step on it, you step on your legs, you're extending, you're walking, you're running with your friends and family, that's the period in time where your load is distributed onto the hinges rather than just on the affected compartment. And that's obviously, it can be understood how can be an immediate relief in terms of pain management. And of course, as I mentioned before, it's incredibly useful for knee stability and overall knee alignment health. So the dynamic pressure is always applied from the opposite side of the affected compartment. And that's how it opens up that narrowing space that Jen talked about in detail anatomically. And if we go into the next slide, I can show you a little X-ray here of what a normal knee would look like, and compared to an osteoarthritic knee, where you can see here the red shading is where the narrowing is occurring, and where the grinding is more likely occurring, and where the cartilage is wearing out. And on the right picture, that's the same osteoarthritic knee or another osteoarthritic knee with a similar level of severity. And then after the application of a brace, of an offloading mechanism brace, you can see that the space there significantly increases, and that helps with the offloading mechanism. That's what causes that immediate relief and the depletion of pressure, or that taking away of that pressure off your knee. So that's really where the relief comes from, and it's very important for you to really appreciate. I always tell everyone this, for you to appreciate how for you to appreciate all the positive impacts of a brace. It's important to know how they work, because they'll also give you a better appreciation of your own body. And that's how I got into kinesiology and learning about the bracing world in general. So it's very intriguing to look at it as a mechanism, because that helps you understand the results. And if we go into the next slide, we can discuss a little bit more about the spring bracing and how it's different. I just wanted to go into a little bit more detail, because the substantial difference is in the additional stability it provides, because it reduces contact forces at such a higher percentage than the normal unicompartmental unloader brace. So not only does it have an offloading function, but due to the embedded springs within the brace, it enables you that tri-compartmental help as well, which, as we can see here from the statistics mentioned, over 90% of people with arthritis either have or develop arthritis in more than one compartment. And that's where the spring-loaded technology becomes futuristic in many ways. It's marketed as a bionic leg in a way, and or bionic knee, and that's where that transition comes from, and that's why it's considered to be the gold standard, as you can see by the little gold star that I placed next to it. So yeah, and if we move on, we can discuss more about the factors that can affect a brace selection, because that's also obviously very important. It's understand from your perspective. I've clearly described which brace is better, but ultimately, what makes care in general and healthcare in general so pivotal is that it has to be customizable. It has to be individualized in a way to you, and we always take into account your own personal cases into this, and that's what we'd be going through when we have our consultation. Our free bracing consultation is discussing individual cases and seeing and assessing the needs on a case-to-case basis. So, for most clients with simple unicompartmental, a lot of the times they can prefer the unloader model because it's about $1,000 cheaper when it's custom made. But it's also dependent on your activity level, and very importantly, I mean, I could have listed 10 more factors, but one of the main factors that you always want to look into is compliance. And in many ways, the spring-loaded technology offers you so much more assistance that it helps with the compliance aspect of it. Because to me, as a bracing specialist, it does me no good if I know I'm giving you the best brace if I don't have certainty that you're going to wear it. So that's why it's so important to have this introductory conversation first and have that consultation to learn what your individual case is like and what your individual knee health is like and what your goals are, because basing a brace off that is so pivotal for your treatment in general. And ultimately, I do want to stress that braces aren't going to magically cure osteoarthritis. All they do is they help support and mitigate pain, and they help support your overall knee health. And alongside physiotherapy, alongside physical activity, they can be an integral part of you moving on to much better knee health. So yeah, that would be all I really wanted to discuss with you today in terms of the braces that we offer. In terms of what a bracing consultation looks like, it is very similar to the conversation we just had. It's just two people having a conversation about your individual needs and assessing your case, and then making sure that we fit you in a brace that feels comfortable to you to have that compliance factor achieved. After every single bracing consultation, my goal is always to make sure that there's a free trial element in there as well. And of course, with the unloader program, we offer them with a free trial, with a 1 week free trial. So you'd be able to come in, get a brace, you can get yours ordered. You can get your spring loaded ordered if you'd like, have it in a couple of weeks, and until you wait, you can have an unloaded brace just to make sure that we don't leave you with nothing while you're waiting for your spring loaded brace.